Good morning. It's Monday, August 8th, 2022. Welcome to Triggered. I'm Cory Morgan. Yes, we're beginning another week. I think these weeks get the work week gets a little longer as the summer goes on. You know, you're just enjoying those weekends so much in the good weather. It's hard to get back into your seat for that other 5 days. But we're kicking off another week. We'll get through it. We'll survive. And we'll bitch about it. That's part of the fun of having live shows and the ability to speak up. So it's good to see you guys in the comment scroll. I got DS from Toronto and others. This being a live show, I like to remind everybody, use those comments, guys. Let's get back and forth. Let's be interactive. That's what it's about. Send questions my way. Have discussions with each other. Send questions for my guests. I won't necessarily read them all out loud, or pass them on to the guests, but I do see them all. And it makes it worth doing these live productions versus canned recorded ones, which there are so many out there already. So again, though, I always got to remind you, I've seen some pretty big scraps break out now and then. Just keep it somewhat civil. We can get upset, but we don't have to be terribly rude. There's good, polite ways to be rude. If that sounds odd, it is possible. All right, a couple of daily observances to get through, and let's see what's going on here. This one's I like, and I understand this so well. It's sneak some zucchini onto your neighbor's porch night. And this sounds absurd, but if you've ever done gardening, you'll understand there's something that happens with zucchini. I'm a terrible gardener. I mean, every few years, Jane and I we plant some stuff, we get some stuff. One thing, though, you watch the zucchini and it gets bigger and bigger. It eats up half of your garden with these giant leaves, but still doesn't seem like much is coming along. And then all of a sudden, one day you lift the leaves and you got all these giant bloody zucchinis everywhere. I mean, these things are just huge. You can only eat so much zucchini, and it only keeps so well. So you take a bag, you bag it up, you sneak out in the night, you dump it on your neighbor's doorstep. Don't want to waste it, right? Hey, it's a nice neighborly thing to do. And, if somebody's creeping around, leaving something on your doorstep, you could do worse than a bag of zucchini. So if you got a spare zucchini, this is the time to go out. Choose carefully on your porches. I live in a rural area now. I think might not be good sneaking around on people's porches at night. I could get myself in trouble, but all the same, this is the time to get rid of your spare zucchini. All right, it's also International Cat Day. So I don't know what you do to observe this one because, your cat really doesn't care. But all the same, observe your cat, appreciate your cat, pet your cat. We got Makachuk and his semi-famous cat that makes its appearances when I interview him, or he's even used for some of his basis for choosing candidates in leadership debates. Today's the day to celebrate those cats, though. Those of you who do love cats, this is the day for it. I don't know. Buy it some extra catnip and watch it bounce off the walls a little. Okay, getting on to the guest today. I got Bacchus Barua. He's from the Fraser Institute. He's their healthcare chair, I guess, or whatnot in there. And he's written a lot of articles and studies about it. We're seeing so much in the news right now with health centers closing, hospitals reducing hours. I mean, it's crazy. We don't manage to just get injured and sick in 9 to 5 hours, but our health facilities can't keep up with the realities, and it's across the country. So we'll discuss healthcare reform and some of those things, what could be done if we ever find the will to do it. And Franco Terrazzano is going to pop on. They wrote a column, him and Chris Sims did, with the Canadian Taxpayers Federation, talking about how Pierre Poilievre, or I guess any conservative leader, could really do a lot of good with direct democracy. And I'm talking about citizens-initiated referenda and, of course, recall. There's always a lot of talk about it, but very rarely when we'll actually get functional legislation for those things. So we'll talk a bit about that. See if maybe we can coax those candidates to embrace some of that stuff for real. And Susan saying the only time rural folk lock their doors so they don't get a backseat full of zucchinis. Yeah, those things, I mean, they tell you they're like an invasive weed. And I mean, I like zucchini, but there's limits. Somebody else said zucchini bread. Yeah, that's good, but you can still only eat and preserve so much. All right, let's see what's got me going. I want to talk about an Alberta provincial police force. So, I mean, last week I interviewed Kevin Halwa of the National Police Federation on their initiative opposing the formation of a provincial police force in Alberta. He made some good points, but for the most part, I felt they were pretty weak. I mean, he is with a police union, and it's focused on the interest of the union rather than the public. And I don't fault them for that. That's just what their job is, and that's what they're about. But it does make me question their motivations. I did point out some reports claiming, the formation of a provincial police force would come at a high cost. And this is true. I mean, everything from new branding to training facilities to cars to office facilities. I mean, it all has to be created or transferred, and it's going to cost a lot of money. That cost will be worth it, though. I mean, to begin with, the RCMP don't come free to the province. They're not some kind of gift, from Ottawa. They're a contracted force. and Alberta taxpayers have to pay for it. They're leased, essentially. We don't own them, but we pay for them. Some people maintain a misconception sometimes that the RCMP is some sort of federal expense and we would be giving something away by not maintaining them as our primary force in the province, and that's just not true. Every dollar spent on the RCMP services right now by the province can be dedicated to a provincial police force, and it should. And the RCMP wouldn't be going away totally. They'll remain as a federal force, at least while Alberta is still within Confederation, and scale down a great deal. They'd be something more akin to the American FBI than a regular police force that's on the ground. And the RCMP, I mean, let's face it, they've been hopelessly politicized. We've seen that in their reticence to follow through on criminal charges with the Prime Minister over the Aga Khan affair, despite their statement, this is from the RCMP, saying they felt there were reasonable grounds that fraud was committed. But they said it wouldn't be in the public interest to follow through with charges on the Prime Minister. Well, isn't it in the public, it isn't in the public's interest to have a Prime Minister who escapes criminal charges due to being the one who directly appoints the head of the National Police Force. That's what the problem is. The public interest had nothing to do with the RCMP decision. It was the interest of senior members in the force who knew that charging a prime minister would cost them their jobs. We've seen evidence of political interference from the Prime Minister's office into criminal investigations, whether it's the Nova Scotia shooting, or quite recently, or the SNC Lavalin affair. We have a government that doesn't think twice about violating rules and laws as they pursue their own and mask their own corruption. If members of the government are above the law of the land, we don't live in a democracy. A provincial police force won't be able to hold the federal government responsible for itself, but it will free Alberta from the police actions directed by the federal government. Why should Albertans pay for a force that's going to act against the interests of the province at the direction of the feds? I mean, for example, it's clear the federal government wants to disarm the nation. They're doing it incrementally through orders in council, as we've seen with the handgun freeze. And rest assured, there's going to be a seizure of firearms coming. And when it comes to that, let the federal government spend every penny then to track down and try and take the property from those law-abiding firearm owners in Alberta. We might not be able to stop the seizure while being within Confederation, but we sure don't have to aid the government in doing it. Let their little RCMP force try to deal with it. It's their job. Our provincial force could then just focus on real crime in the meantime. Localized policing would be more effective for the province anyways, particularly in rural areas. Mandates and priorities would be based on provincial needs rather than federal ideologies. Police members wouldn't constantly be parachuted across the country into regions where they have few connections and no understanding of the local cultural community that they're now with as the RCMP. A new provincial force could be crafted with a more modern mandate too. I mean, morale is terribly low among RCMP members right now, and the workplace culture has put pressure on a lot of them, particularly women. This mess might not be repairable with the RCMP, but can be addressed and avoided if a brand new force takes these things into account upon its creation. So yes, a provincial police force would cost more during its initial formation, but it'll be worth every penny. The status quo is going to cost us a hell of a lot more in the long run if we let a government obsessed with control of citizens continue to control our local policing. And that's what's got me going today. Okay, let's check into the newsroom with our news editor, Dave Naylor, and see what's happening over there. He's made it just in time from that wonderful traffic on the Deerfoot this Monday.
Have I mentioned how much I love Deerfoot Trail, Cory? It's just the best designed road in the entire world.
Oh yeah, it's a something to be proud of.
Oh man. Hey, I hear there might be some positive news for a change on your bee front.
Well, yeah, I've set up, I was pretty excited about that, a swarm trap. I put it up quite a while ago. What it means is you put up kind of a box with some bee scent in it and a little bit of a comb in there and a few things. And if a swarm happens to come by, they might say, hey, this is a good place to set up shop. And suddenly you get a whole bunch of free bees. And it's pretty much been ignored all summer. And yesterday, there were a bunch of scout bees hanging around the entrance. So, I mean, I lost a bunch of bees in a swarm recently. I might actually gain from somebody else's swarmed hive and regain my losses there. But I'll be watching carefully.
So this isn't your bees coming home?
No, after this much time, it wouldn't be mine. So it's somebody else who's suffered the fate that I did and lost half their bees to a swarm. But maybe it would be like an exchange program.
There you go. Arthur Green in Edmonton's had a busy morning also, Cory, with the UCP leadership race. He's talked to Brian Jean about the issue of a provincial police force. And Jean said he'd almost like to see a hybrid where, cities and towns can take over policing in the cities while the RCMP just takes care of rural Alberta. So you'd have the provincial police within towns and cities, and then that would free up the RCMP to put more boots on the ground in rural areas. So that's Brian Jean's take on it. Danielle Smith has put out a policy on how she's going to protect our kids, she calls it. Basically, no more lockdowns and lots of more mental health help for them. This weekend, Cory, was the 25th anniversary of the Saskatchewan Party. So they held a big celebration out in Davidson, Saskatchewan, attended by no less a luminary than former Prime Minister Stephen Harper. And he was there with current Premier Scott Moe. And 25 years they've now been a political force in Saskatchewan. So some interesting political news on the website this morning. Our Dave Makachuk has just filed a good exclusive, Cory. He's talked with a Manitoba farmer who was just back from the Ukraine, where he assisted in teaching Ukrainian farmers how to hold and fire a rifle and get ready for the Russians coming over the hills. So very interesting column, and we'll get that up shortly.
Right on. Well, it's a good kickoff to the week. Sort of a little slow in the political news. I guess we're into those doldrums into the end of August. They're kind of all doing constituency work or taking a breather before the fall whirlwind begins, I guess.
Yeah, but it's good that we have the two leadership races, the federal Conservatives and the provincial UCP. So there's enough copy to keep us busy.
Yeah, well, then just that good time to remind everybody, I'll segue that fast. You'll be there tomorrow as well. We've got our debate happening at the rooftop tomorrow in Calgary with the front runners in the UCP debate for people who want to get that chance to see them firsthand and see what they got to say.
Yeah, it should be a good event. I'm looking forward to it.
Right on. Well, thanks, Dave, and I'll see you after the show.
Thanks, Cory.
That is our news editor, Dave Naylor. And yeah, running through the stories of the week. Lots of stuff still always going on. We got people all over, as we said, Arthur Green. We got Matthew Horwood out in Ontario, that poor fella, and Reed Small out in BC. Christopher Oldcorn, Saskatchewan. We're just spreading across this country to give you good, independent news coverage. And the reason we're doing it, guys, is because of you, because you've been subscribing. That's how we bypass government control. That's how we don't deal with tax-funded media that has to dance to the tune of the federal government, is through paying for our media directly, and that makes us accountable to you. We don't take any tax dollars. You guys have come through great. Thousands of subscribers. If you haven't subscribed already, get on board, guys. Take it on. $10 a month, $99 a year. It's a good deal. You get past that paywall and straight to that good original content, whether it's the opinion stuff or the news copy, of course, which is most important of all. So go to westernstandard.news/membership and take one out, guys. We really appreciate it. And it's good for all of us. All right, let's talk about some of this other stuff. Sylvia's saying, so why keep the RCMP? It's either one or the other. We can't afford both. No, actually, it's not. We can't get rid of the RCMP unless we get out of Confederation, which is a discussion I'm always happy to have. But they are a federally mandated force. Every province, even if they have provincial police, still have RCMP. The thing is, though, we wouldn't have thousands and thousands of thousands of RCMP. They'd just be a small federal force. And yeah, we won't spend a nickel. We won't dedicate a nickel towards them. If the feds want to send them here, they can, but on their dime. And I know it still comes out of our pocket in the end anyways. But it would be a much, much smaller presence with a much, much more limited mandate and area that they're going into. So, no, we wouldn't get rid of them. And saying we already have RCMP and sheriffs, yet crime's on the rise. Well, that's bigger other issues, absolutely. The bottom line is, though, if we have Alberta police, they aren't answering to Trudeau. And you know what? That's worth a lot. That's worth a hell of a lot. Though, the mandate has to be carefully made. If we just make a provincial copy of the RCMP and they aren't well accountable, they aren't, as somebody else I saw in the commenters was saying, it has to be accountable to the citizens. And that's true. Like this force has to be done right, or we're just duplicating something else that's gone bad. And I'm not one of those who's going to say that every RCMP officer is bad. No, not necessarily. There's a lot of very good officers out there, dedicated ones. I think if a provincial police force was formed, a great deal of those current RCMP officers would probably transfer over to it, actually, and maybe be happier in a new force. But, it's funny how this debate has gotten so heated. Guys, They've done it in Ontario and Quebec, and I think Newfoundland even has their own. Why are Albertans always assholes when we're the ones who want to try to do something that other parts of the country are already doing? That's what gets tiresome. That's what helps build that movement for an independence movement, because all we're asking is to do the things the other provinces are doing, and somehow we're radicals and we're hicks and we're wrong for wanting to do it. Provincial police forces, again, they're not perfect. The OPP has all sorts of problems. What I see with it, though, is an opportunity. When you get a brand new force, think of that. If you can create a force from scratch, you can build and learn from the mistakes of the other forces. Find out why then it wasn't so good with the other ones, and see what you can do with them. And yeah, Brian Jean's been talking about that. Heko saying, a commenter saying, idea on hybrid policing isn't going to work. RCMP overreach from the federal government must be eliminated entirely. Well, again, there's only one way, to completely eliminate the RCMP, and that's independence. And people aren't ready for it yet. But we can certainly start moving towards it a lot. And one big step is getting rid of that force, at least as the prime one in the province. Let's see where else. I'm just going through the comment scrolls, guys. That's why my head's turned off to the side. And Alberta's Canada's Texas. Yeah, I think in a lot of ways. But Texas has a good more independence. I mean, they're certainly respected within the United States a lot more than we are. But they have to, because Texas has a couple of senators, just like any other state. It's not like Alberta, where we have fewer senators than PEI. I think, or well, not quite, but terribly. We're not represented right. We can't stand up for ourselves. Thus, the independent movements. Okay, let's see what else we got going on. Talk about some news things. This one was interesting, and it's not making headlines as much as you would think, but 2/3 of the Great Barrier Reef in Australia recorded actually the highest amounts of coral cover in 40 years. So, I mean, that's always been an area that the climate alarmists always warning us about. We're going to run out of all our reefs. The reefs are all going to die. They're all going to bleach out. We're all going to die. We're all going to die. Blah, blah, blah. We're always going to die. Saw that in the news last night when they're giving the weather forecast for the week in Alberta. Of course, the whole province is all deep, deep red. I mean, I'm surprised they didn't actually put little flames and smoke and everything and show us cooking. It's just a run-of-the-mill heat wave like we've seen every summer for the last few thousand years or so, but we got to make it scary. Well, they've been doing that with the reefs and making us scared. We're never going to have reefs again, and then the world's going to die. Yet, 2/3 of it now have got the highest amount of coral cover in 40 years. No, and it's not saying necessarily that climate change isn't even happening. What it is saying is the world's more adaptable than these alarmists like giving it credit for. Things change. How much we can impact them positively or negatively is debatable, but they change. And in this case, it's changed that the reefs are growing back. And I think there's other reports that come up quite often that we see more ice cover in our Arctic areas year by year and less on others. It changes, but of course, they only report on the scary stuff, not on the positive stuff. So reefs are sensitive, absolutely, and there's things to do to try and preserve them, but they're obviously not nearly as much at risk as of course the climate alarmists like us to be. And that's what I get sick of, the fear. CTV, speaking of legacy media, if we're going to talk and pat our own backs here at the Western Standard and the independent abilities we have, CTV, man, they've just gone brutally bad. I mean, I still tune into them on the weekends and the evenings just to see what's up on the headlines. Eventually we'll get big enough that maybe I'll have the Western Standard channel on my regular TV and I'll be able to watch that at night. But they are just right up there with the CBC with their alarmism, fear, everything, COVID, monkeypox, global warming, you name it. We're all going to die. We're all going to die. It's exhausting. We won't do that. We're just going to report on facts. So I like to remind everybody. So the next time you hear somebody saying the reefs are all going away, actually, no, they aren't. You get another alarmist prediction that didn't happen. Al Gore gets a Nobel Peace Prize for lying, saying our polar bears are all going to be drowning by now. Well, aside from that, we've also got the coral reefs are not all vanishing on us, contrary to what some people would claim. Here's a neat one. All legacy media in Canada. Oh, this is from Jay there. All legacy media in Canada is propaganda. You get what you pay for. Yeah, and unfortunately, we got to pay for the crappy propaganda too, as well as if you pay for things with the Standard or other independent outlets. The difference, though, is if you don't like our stuff, you don't have to pay for ours. So I mean, we're user based, and I talk about that all the time when it talks about media, because you are always accountable to who pays your bills. You dance with the one who brung you to a degree. So as long as we're independent, we have to answer to you. Maybe we'll have ups and downs. Maybe we'll piss off our subscribers and lose some subscribers at some point. So far, it's been a good growth. We're obviously providing what people are looking for. But if we stop providing that, our ratings will sink. We'll have to contract, and we'll figure out where to go from there and improve it. When it is, Jay was saying, no, Justin paid for it. I mean, yeah, I know, yeah, kind of what you're getting there. So, I mean, it allows that proper evolution of what you guys want to see is what we're going to learn to provide, or we'll get, off to the wayside because we won't be able to sustain. But it's artificially regulated. This happens with every business when it gets subsidized. It no longer reflects the needs of the market. It reflects what the government wants. And the government's interests are rarely the same as our interests, unfortunately. So get left by the wayside. And with media, it gets very scary because, I mean, again, we've got to get our information from somewhere. Not everybody's out on the streets to find out what's happening in person and firsthand. And it's got to spread out. So, I mean, we've got a good trend, though. We know that's why the government's terrified. It is working well right now because we got independent outlets like us, or Rebel, or Epoch Times, or True North. I mean, they're out there, and we're getting the news to people despite what the government thinks. But then we see the government response is Bill C-11, C-18. They want to control information, but the fact that they're trying so hard as well lets us know we're over the target, guys. The government's scared. They can't control things, so they're trying to find new ways to do it. But we'll keep finding new ways to get to you, and independent media is going to be the way we're going to do it. Here's a beauty. It shows the attitude of government, the attitude of the world these days. Hero medallion for everyone. This sounds like a joke story almost, right? Like, the public health agency, who screwed up so many things with COVID mismanagement, and they're giving the pandemic hero medallion to every single employee. Look at that, guys. You get a ribbon for participation. You're a hero. Good for you. Come on. This is our tax dollars at work. These guys are incompetent. But, our civil service, this is an area where we are in grave, grave trouble as a country. And we need to reform it. And that's something that's also came out in the news recently is the civil service is a lot of the workers aren't coming back to work, which shouldn't be such a shocker, I guess, in some ways. But we got a real problem. I mean, passport renewals, you name it, all these different services are in the toilet. But a lot of the area that it seems that which is leading to this problem right now is that a lot of these civil servants aren't eager to come back and do the job in the first place. So, I've been talking a little overtime. I see my guest is in the lobby there, and let's bring him in and have a conversation. We'll pivot back into some healthcare talk, because I've been kind of rambling on the civil service. It's tied into government expenditures, but this is a bigger one, and I've been looking forward to speaking to him. So this is Bacchus Barua from the Fraser Institute. Thanks for joining us today.
Good morning, and thank you so much for having me on the show. Sorry I had a little trouble getting connected.
Oh, that's okay. It happens to all of us now and then. I'm glad you made it, though. Once in a while, being live, sometimes people don't show, and then I've really got to babble incoherently for, another 20 minutes till the next guest gets on. So you made it.
I'm here, so let's talk together.
You bet. So, I mean, as I kind of said earlier in the show, I mean, we're seeing it right now. It's headlines across the country. Our healthcare resources just seem to be incapable of keeping up. We've got in Calgary an urgent care center that's been reducing its hours. One in north of the city that's shut down for weekends. I believe in the East Coast we're seeing again hospitals and such that just don't have the staff or the ability to keep up. But still, we aren't hearing discussion on the system, and that's where I get concerned.
We're in a very, very difficult situation right now. As you said, there are areas closing across the country. We have many, physicians who are leaving the system. There are situations where nurses are burnt out, and of course, none of it is really their fault. They've had an incredibly difficult 2 years, but it is a tough situation right now that should not be taken lightly. It's probably, the first reaction would be to kind of put all of the blame or the onus on COVID-19, and certainly COVID has pushed the system to its limits and exacerbated a lot of the problems. But to really understand what's going on, we actually need to roll back the clock a little bit to 2019 before COVID was there, because then we can start to disentangle what's due to COVID and what's actually due to our system. And one of the things that we can do is look at one of our studies, actually quite a few of our studies in 2019 that look at data for Canada compared to other countries in the OECD, specifically countries with universal healthcare. And what we find is that Canada, for the longest time, is routinely ranked amongst the top spenders, but we aren't seeing value coming out of that spending, at least not to a commensurate level. We routinely rank, either second highest as a percentage of GDP after adjusting for age, or eighth highest in terms of per capita. Again, that's out of 28 universal healthcare systems, so really amongst the top. But when we look at the numbers for physicians, we were right at the bottom. We were ranked 26 out of 28 for physicians. We are ranked 14th out of 28 for nurses, and we were ranked 25th out of 26 for beds. So even in 2019, this is the picture of the system that was already pushed to the limits, and we experienced those limits during COVID-19, and seems like we're starting to fall off that precipice.
Yeah, and it's unfortunate that COVID's kind of exacerbated a problem we already knew we had, or at least those of us watching the system knew. But I mean, so if we're going to look at systemic reform, hopefully some people are ready to start, at least poking into it, because we've turned it into a bit of a sacred cow, and people don't discuss it. But we've got to accept that there's got to be some changes. But that key word that a lot of people miss is universal. I mean, that's the value everybody wants, I believe, in Canada. They don't want to move away from that. They're fearful that we could move into a system where they wouldn't be covered any longer. But that's not what anybody's proposing at any point.
No, and one of the things we've done very purposefully in our report is only looking at countries with universal healthcare, and I think it's a little sad that the discussion in both Canada and the United States tends to focus on each other a lot of the time. The United States loves to, well, I'm not saying the United States in general, but a lot of defenders of their system seem to, want to rail against Canada's wait times very specifically and say, well, that's how all universal healthcare systems look. And in Canada, you look south of the border and say, oh, we don't want to import the problems that we see in the United States. And really, we're just putting blinders on ourselves. I mean, there are countries like Switzerland, the Netherlands, Germany, France. All of these countries have universal healthcare. They're spending about the same as we do, but they have remarkably more doctors. They have more nurses. They have more beds. And of course, all of them had the same struggles with COVID-19, maybe to some varying degree. But they were starting at a very different baseline. I have some interesting numbers when we're looking at wait times for elective surgery. This is from the Commonwealth Fund, and it reported that in 2020, 62% of Canadians were able to get surgery within 4 months for elective surgery. By contrast, in Switzerland, 94% of patients were able to get treatment within that time frame, and in Germany, 99%. And before even then, 2020 is again getting into COVID territory. But if you look at 2016, the numbers were basically almost the same. In fact, in 2016, 0% of German patients were waiting longer than 4 weeks for elective surgery. So these are all countries with universal healthcare that don't seem to have the long wait times that we do. And in some cases are actually spending the same or lower than Canada is. So the key really is not about spending, which is unfortunately what all of the current premiers are advocating for with their increased CSU transfers, but it's really about what is happening to that spending. Why is it not translating into more doctors? Why is it not translating into shorter wait times? And what can we change in our policies? And what's stopping us from changing those policies right now?
Yeah, well, I imagine the answer to the question of what's stopping us is the Canada Health Act. It needs some changes to allow the flexibility to make some policy changes. But let's say, assuming the government's receptive to opening the act and changing some of these things, what sort of changes could we implement then that would help us move more towards those sorts of outcomes, like Germany, in a universal system?
Well, when we look at the basket of countries that generally perform better than Canada, there are three things that they do very differently. The first is their general attitude towards the private sector. And that is looking at the private sector as a tool, either as a partner to deliver on the universal healthcare promise, or as a pressure valve to kind of, serve as a way out once the public system's overburdened. The second thing that they do differently is that they generally expect patients to share in the cost of treatment. Now, this is, something like maybe a $300 to $400 deductible. It could be 10% of the cost of treatment. Of course, they understand that they need to be limits so that there's never a financial burden. So there's an annual cap on payments. There are exemptions for vulnerable populations. And the third thing that they do differently is they fund their hospitals based on activity. And what that does is that ensures that money is actually following the patient through the system. In Canada, because we have this sort of, for lack of a better word, a government monopoly over the financing and delivery of care, we have these global budgets, which the incentive structure is such that patients are treated as a cost to the system, because every time a patient comes in, they're eating into that budget. Contrast that with activity-based funding, and money is following the patients. The problem is that you can't implement any one of these and expect healthcare to be magically fixed. It's probably a palette of these options because each of them temper each other. The cost sharing sort of tempers demand. The activity-based funding ensures that supply is reacting dynamically. But the thing is, right now we're in such a risk-averse environment because of the Canada Health Act that if provinces even try to do something, the federal government usually is coming down and clamping on them and saying, hey, you're violating the act, or you may violate the act, and we're going to penalize you for it. And that's very unfortunate because one of the most successful experiments was in Saskatchewan with the Saskatchewan Surgical Initiative, where they partnered with private clinics to deliver third-party day surgeries within the public system. They also had a pooled patient referral system where patients go into a central pool and they're referred to the physician with the shortest wait time, and they had a number of other changes. And that actually resulted in Saskatchewan going from a province with one of the longest wait times to one of the shortest by 2014 or 15. But ultimately, their wait time started to go up again after that because they couldn't do any more reforms, because the federal government started to say, hey, if you try anything now, we're going to actually penalize you by wielding the Canada Health Act. And that's not the sort of incentive structure that you want. You want provinces to try the best that they can to experiment with different policies, to try and see what they can do, because they really have the interest of their residents at heart. So don't stop them. Encourage them to try things that will result in better or quicker treatment.
Yeah, well, it's unfortunate the way our country's kind of laid out, I guess, with jurisdiction. The federal government is the regulator with the Canada Health Act. They sort of impose the rules, but then they dump it on the provinces. Says, okay, but it's up to you guys to deal with everything else. You've got to deliver it. You've got to set up the infrastructure. You've got to recruit the staff. And it's just sort of a catch-22 as it sits there. Each can kind of deny responsibility. I mean, likewise, a province can also say, well, it's not my fault. It's the Health Act. And the federal government say, well, it's not our problem. It's the province. But of course, it's the consumers who always lose in the end.
You're right. There's actually a lot that provinces can do within the confines of the CHA as well. Some of the things like activity-based funding, it's no problem. And there are provincial legislations that actually sometimes go far beyond the Canada Health Act. But I would go back to it because the thing is, ultimately, the Canada Health Act is so vague that it can be interpreted by the federal government of the day to be contributing any aspect of it, particularly with the section about reasonable access. So it's just, you don't want a risk-averse environment when you're talking about policy. You want a policy where you say, look, what we care about is the patient, and the system comes secondary. Unfortunately, we're in a situation where the system is given priority and the patients come secondary. It's backwards.
So, I mean, I know this gets you work more into the policy and the alternatives, but I mean, I believe, politicians are typically driven by demand from the people. They want to get reelected. I mean, if we could see more public will, people saying, hey, we want to see some systematic reform, the politicians are going to act on it. But that's there's some really entrenched mythologies, I guess, about our current system and a few things that have to be chipped away at before enough people are ready to say, yeah, let's try some different stuff out.
Yeah, I'm not a political pundit at all, and I often am reminded of those New Yorker cartoons where politicians are leading from behind and saying, hey, I see where the crowd's going, and let me please lead you there now. But I do think that there is a lot of reform coming from the ground up, because the thing is, at the fundamental point, once Canadians have information, once they understand that there are other ways to do it, once they understand what's happening with the system, they start to demand change. And you see this happening in a variety of different ways. You see it happening, with things like the Canby court case in British Columbia, where Dr. Brian Day, the former head of the Canadian Medical Association, is fighting with alongside a number of patients to simply get the right to treat them within his hospital. and you see it. You've seen it already in Quebec with the 2005 Chevrolet decision, and then you also see it happening at a real, a normal reactionary level with Canadians starting to look towards things like virtual care and video appointments, which in many ways really circumvents the entire restrictions of the CHA, and you're starting to see, I would say, a lot of defenders of the status quo now starting to clamp down on virtual care and private care, which really had been quite a huge help during COVID-19. But the thing is, I think that will be a futile fight, because the thing is, you can perhaps try and clamp down on these appointments within a doctor and a patient within Canada, but there's nothing that's going to stop a patient in Canada trying to get an appointment with a doctor in South Africa if that's the only way that they're going to get that consultation, unless you build some sort of a firewall, which would be an entirely different story. So yes, I'm a firm believer in Canadians and their ability to embrace and process information and demand change, because fundamentally this is about their healthcare and they are the payers for it.
Well, that's it. When times get tough enough, well, people suddenly can become more receptive to changing anyways. It's unfortunate that it has to go down before it can come up, but when you realize you can't get yourself a physician or can't get treatment in a timely manner, and you start looking at things and realize, well, it's not for lack of expenditure. I mean, Canadians aren't fools. They'll start pressuring the right way, hopefully. So I guess more conversations we can have and showing people, like, it's not that polarized thing. There's much more than a Canadian-American world out there. We could start getting our policymakers examining some more innovative options soon, I hope.
Absolutely. This is really about universal healthcare that is trying to ensure that there's timely access to treatment regardless of financial ability to pay. And there are at least, it's sort of like Baskin Robbins. There's like at least 27 other flavors of universal healthcare, and we have the blinders on. We're focused on Canada versus the United States. It's betting on the two horses that are coming last in the race and forgetting about the top 3 or top 4 of the performances. Unfortunately, you're right. We're in a situation where we're now being forced to make these changes because our healthcare system isn't able to keep up with it. And we've been talking about this for 10 years, and unfortunately, there's a situation that's brought it to the fore. But again, we have an ability to work on it right now. And I would say start doing it right now before wait times go even further than what our last measure of wait times was 25.6 weeks between referral from a GP to getting treatment, according to a national survey. We've been doing that since 1993. And at that time, that wait time was 9.3 weeks. That's an increase of 175%. If you want to take out COVID from that, the wait time in 2019 was 20.6 weeks. This is a fundamental systemic issue that has been really pushed and exacerbated by COVID-19, and we've got to tackle it before it really becomes, a dangerous situation in the future.
Yeah, it's not going to get better without some effort, without doubt. Well, thank you very much for the work you do and putting those studies out there and such, and for speaking to us today. So before I let you go, where can people find more information on the work you've done and see some of those alternatives for healthcare provision out there?
All of our information is free and publicly available at fraserinstitute.org.
Great. Well, I thank you again. And hopefully we'll start seeing some positive changes soon. I really do appreciate your work, and hopefully we can talk again down the road.
Thanks so much for having me on the show.
All right. Thank you. So that was Bacchus Barua from the Fraser Institute. And as you said, fraserinstitute.org for more information on the whole thing. And it's huge. It's healthcare. It's one of our biggest expenditures. It always has been. And we've people are concerned about it, but they're scared of change. And we got to start having those discussions about other systems, other means, other ways to do it. Hey, I'm going to speak. It's not just the subscribers that help us pay the bills around here. It's the sponsors. And this is a great one. I'm so happy to have these guys back. And it is Resistance Coffee. So, I mean, if you're tired of having leftism rammed down your throat everywhere you turn, and we do, don't we? You're frustrated by businesses, you support giving money to leftist causes. I mean, don't you hate that? You buy a coffee somewhere and then you get to the end, hey, 10% of this is going to whatever crazy left-wing cause of the day. Well, Resistance Coffee Company is here for you. It's here for our kind of listeners, guys. You can enjoy good coffee. It's good. It's fresh roasted, and the money isn't going to leftist cause. In fact, 10% of it will go towards causes that are standing up for your rights, such as the JCCF. That's the ones that have been defending Tamara Leach and others. 10% of your purchase goes towards that and other groups. If you go to resistancecoffee.com and check them out. And if you go there and resistancecoffee.com/triggered, you'll get 10% off your first order. So you get 10% off that. 10% of your purchase also goes towards good causes. And best of all, you get good coffee. I don't want to sell you a crap coffee to make some sort of political statement. It'd be hard to do that. No, it really is. Plus, they got some great swag, like this Liberal Tears mug, Resistance Coffee on the other side. They got t-shirts, all sorts of great stuff there, guys. You can make a statement, enjoy coffee, and support us all at the same time. Check them out, resistancecoffee.com/triggered. All right, let's get back to some of this discussion here. Tiggy Cat saying, how about enabling naturopaths instead of tying their hands? There's one of the things in medicine that's a little different as alternative was. I'm not huge on naturopaths, but if it's a grown person wants to do that, and if they feel that works for them, then they should. But you're limited by this box of where you're going to get, what type of care you're going to get, and not an expansion. I know Daniel Smith was talking about giving the healthcare savings accounts to allow people to purchase stuff on the sides and things like that, more flexibility in where they might choose to get their care or what kind of care they want to get. I'm not opposed to giving people those options. Again, we're grown up. We shouldn't have a gun to our head, and that's what it is. It's illegal to get any other care, essentially, aside from, what the government mandates. I mean, you can get some of the other ones, but the bottom line is it's illegal to open a private hospital. Why? We're suffering from this. How far does the suffering have to go? How bad does it have to get? And we've got to get over that squeamishness when it comes to, profit. So what? Or payment for things. Like, one of the number one things that gets me all the time is blood donors. In Canada, they're always low on blood. They're always nagging for more and more. And if you look out there, and Jane, actually, my wife has a rare blood type. We give blood occasionally and everything, but she looked into they're always sending emails. We want that blood. Great. Well, we could schedule you up there 2 weeks from next Tuesday for maybe on that. It's so impractical and inconvenient to do it now. Plus, of course, it's illegal to pay somebody to donate, and plasma, even more importantly. So what's happening? Well, for one, in blood, they're running short. With plasma, because they don't pay for it, what they're actually doing is buying plasma from the United States and bringing it here to Canada for our healthcare system. And why do the Americans have spare plasma? Because they pay the donors. So here's the irony. You're not avoiding people who get paid for providing it. We're just giving the money over south of the border when at least there could be some Canadian donors, a great deal more. I hate to say it, that's just the reality. If you pay a few bucks for it, a hell of a lot more people are going to come out and give it. That's just the way it works. So we're paying it anyway. Let's do it here. But we can't. We won't. Our acts won't allow it. It's illegal. What happened to my body, my choice? It's my plasma, my blood. I should be able to sell a kidney, to be honest. It's my kidney. Or, sperm donors. Let them sell it. Hell, I mean, how many was lost in college sweat socks in the past anyways? If somebody wants to pay for it, let them sell it. It's their bodily fluids, and it reduces that overwhelming demand. And I mean, blood is critical. Plasma is critical. A lot of this stuff, bone marrow transplants, kidneys, things that people can give out. A lot of people do it altruistically, and hey, great on them. I mean, I give blood as well. I'm not one of those who gives chronically, I guess you could say, but I've done it a number of times when I think about it and it's practical. But if you start paying, it's amazing how much difference. Just get over that squeamishness with it. A person shouldn't have to. Well, whatever. Whether they shouldn't have to be paid or they should. The reality is our current system isn't keeping up. So let's just face some reality and work based on that. So, but this healthcare standoff we got, it's just brutal. Meanwhile, again, as the guest was saying, people, the wait times are just intolerable, and they're getting higher and higher and higher and higher. Why can't we face that reality? It's not working. But I tell you, one of the words that scares them all is keeping it unions. It's the unions, guys. We've got a big bloated system controlled by unions, dominated by unions, and politicians are terrified of unions. They don't want to bring in private delivery options and stir up those unions and then suddenly run themselves into a nurse's strike or a custodian strike or any of those very important skills. But they get that stranglehold on the system. And I tell you what, it's kind of like we was talking before, the union's interest is in the union, not the patient. So let's not pretend that you're going to get better off when those guys are calling the shots. And until somebody gets the huevos to take them on, it's going to be getting worse and worse. Here's an interesting thing too. So this kind of shows it. And I remember that because I used to work in the oil field, and I listened to a lot of talk radio back then and things like that. I worked in Saskatchewan a lot in exploration. So it's been 25 years since the Saskatchewan Party came about. Now, for people going farther back in Saskatchewan history, the reason they came around, this is the way it's done right, guys. The UCP is still trying to figure it out, I guess. But it'd be Saskatchewan had NDP into the 90s. And it was costing them a fortune. They got such a massive amount of bloated crown corporations there. They still have a fair amount. Again, it's that union thing. But the conservatives, the progressive conservatives, were so corrupted and so bad under Grant Devine that it took that long for the conservatives to get it together with a new party, which was the Saskatchewan Party, and took power finally down the road. And if you remember far enough back, I remember the saying about Grant Devine's government. I think it was, to screw up is human, but to truly F up is divine. Or to err is human, truly F up is divine. And it was bad. His cabinet ministers were corrupt. It was just a disaster. So they sunk conservatives in Saskatchewan for years. Those days are behind them. But the things back then, it's like some of it, the NDP in Saskatchewan were fighting against private diagnostics, hard and heavy. I mean, we had these parallels. We had Ralph Klein in Alberta, and you had the NDP in Saskatchewan. So we had all these new MRIs which are coming in, and Klein was fighting with the federal government about that because they were bringing in private MRIs and things. And Saskatchewan said, no, we're sticking to the socialist system. And I believe the MRI waits in Saskatchewan got as high as 22 months. Yeah, if you needed an MRI, you're going to be waiting almost 2 years for it. But hey, it's free. Worth it, isn't it? And you think about how important diagnostics are. I mean, the faster you can get these tests done, the better the chance you might catch some sort of condition that's treatable while it's still treatable. You put these things off and, oh, okay, yeah, 22 months later, you get your MRI and you say, yeah, you've had this slow growing cancer on the go and we could have treated it, 10 months ago, but I'm afraid we've left it too long. Get your affairs in order. That's what's happening. Once the Sask Party came in, started pushing back, got more innovative, they're back down. Meanwhile, Alberta's diagnostics, the wait times were going down and down and down and down. We got to face reality. And some of those other creative things the guest was talking about, what about a lot of consultations, things that can be done remotely? Again, see, this is where unions don't like this sort of stuff, right? This cuts into, if you do a remote consultation with a doctor, you don't get all those levels of nurses and administrators and all that busy on this, so you lose those jobs. That's all they care about is their friggin' union jobs, not you. Because how many of your times seeing a doctor were just a simple question? It was just a couple of things to put your mind at ease, or maybe it was something more serious and the doctor says, okay, you're reporting these symptoms, these things, you're doing it virtually online, go in, book an appointment, get in there in person. But if you could wipe out 20% of the consultations and have them done virtually and online, why the hell not? Same with a lot of things like prescription renewals, minor things can be done through a phone call or even, more so online. Here, have a look at my camera. I got this big mole on my back. Should I get it looked at, doc? I don't know. There's things that we can look at, but our rigid system fights them. And it's hurting us all. And we've got to get the courage to take on the defenders of the status quo with this system. It's nothing sacred, people. Nothing. I know I get the religious folks stirred up when I point out I'm certainly not, aside from that flying spaghetti monster I got drunkenly tattooed on one arm. That's the closest I come to being a faith-based person myself. So I don't look at anything as sacred. I just look at what's going to be important for us right now. And I tell you one thing that is most definitely not sacred is our healthcare monopoly. We've got to start realizing it's not serving us well. It needs to be challenged. It needs to be reformed, or we're all going to lose. Now, I'm going to bring in my next guest, and he's not talking about that today, though. I think he's of similar mind with those sorts of things, but that's a different discussion for a different day. And that's Franco Terrazzano of the Canadian Taxpayers Federation, because we're talking about political accountability through direct democracy and recall. So, how's it going, Franco?
Cory, I'm doing great, man. Thanks so much for having me on today.
Oh, no problem. So we had a column from you and Chris the other day that went in. It was talking about how Pierre Poilievre, or I guess I could kind of read into it, any of the leadership candidates could have an opportunity to really bring in some good policies of accountability through things like recall and referenda.
Yeah, that's exactly right. Now, the reason that it was addressed, mostly focusing on Polyev, is just because that's essentially what he said that his campaign is focused around. Now, we'll get to that in a second, but Cory, let me just provide a little background. I'm sure most of your watchers and listeners understand what recall and referendum legislation is, but let me just really drive the point home. So, recall legislation, it allows people to start a petition if they're angry at a politician, and if they get enough petition signatures, then they can force a by-election to boot that politician in between elections. Now, referendum laws, which is typically known as citizens' initiative, is very similar. Essentially, if you want to propose a piece of legislation, or you want to axe a piece of bad legislation, then you can start a petition drive. If you collect enough petitions, then you can force that legislation to be voted on in a referendum across a province, across a city, or of course, across a nation, which is what we're hoping that the next Conservative leadership hopeful will bring in if they're elected prime minister, is a national recall and referendum legislation that we've been pushing for like 30 years.
Yeah, I mean, with those referendums or those legislations as well, I mean, another part of the puzzle too, though, is to make sure that they bring ones in that are workable. That was one of my big disappointments with Premier Kenney, is he promised it, he dragged his feet on it, he waited a long, long time, then finally put it out, but he set the bar in places where we know damn well that those are not going to be functional, pieces of legislation. That a person can't realistically initiate that kind of action.
So, Cory, maybe we might disagree here a little bit, but let me start with the good and the bad, right? Or because there's both. I think it's a bit of a mixed bag what Premier Kenney did. I mean, first, I think it's important to recognize and give kudos where kudos is due. And where the kudos is due is that we do have some form of recall in Alberta, some form of citizens initiative in Alberta. I mean, that's something that guys like you and me have been pushing for a long time, the CTF for 30 years. And another thing that we have to talk about is that another good part of the legislation is that it's extended to the municipal level, right? Because we know, Cory, more than anyone else, that those councillors sitting on city of Calgary, for example, they need to be held accountable outside of elections as well. But to your point, Cory, let's talk about the mixed bag issue. So some of the downfalls. Now, we and myself presented to the committee at the Alberta government, and we were recommending the Alberta government set the recall rules at about 25% of votes cast in the last election. So a lower threshold, to your point, than what Premier Kenney brought in, because they brought in something that was, what was it, but 40% of eligible voters. What we pushed for was 25% of votes cast in the last election, which would have been a little bit easier for citizens to actually hold their politicians accountable.
Yeah, well, that's it. I mean, I credit where due, as you said. At least if the legislation's already into, then it's easier to amend the existing legislation than starting from scratch. I mean, the principle's there. It's just if we can make the case that the bar is set too high, and there should be a bar. I mean, we don't want frivolous referendums held on everything, or recall initiatives just every time you don't like who got elected. But I think a lot of people don't understand, too. 25% of the votes cast, that's a big chunk of names to get on a piece of paper in a real petition. Some people say, oh, it'll be done easily. No. If you've petitioned before, that's a lot of work. It's got to be serious before you get that.
Well, and that's the type of balance that we were trying to strike, Cory, with a recommendation, right? On the one hand, we wanted type of legislation that actual people can actually use, right? So if their politician gets caught dipping their hands in the taxpayer cookie jar, we wanted a tool that people could actually use to give them a pink slip. But on the other hand, to your point, we also have to strike the balance so that political chaos doesn't ensue and that there's not recalls every other day, which might be entertaining, but of course that's not how the system would work. Now, one thing I want to point forward, Cory, is that we have seen a lot of success in Canada with recall and with referendums. BC was actually the first province to put in recall and initiative all the way back in 1995. There was one successful recall campaign when they had an MLA who got caught sending fake letters to the editor. And then there was a successful recall campaign that collected enough signatures, and he finally stepped down when the writing was on the wall. But there was also a successful referendum campaign in British Columbia because of this type of legislation. And it was when the BC government bungled the process and tried to raise taxes when trying to harmonize the federal and provincial sales taxes. So that piece of legislation allowed voters to say no to that deal when the government bungled it. But also, we have seen two other examples of referendums that have been very successful, even though they weren't triggered by provincial legislation. Of course, number one, I'm talking about the Calgary bid boondoggle, where the people were able to say no and really fight back against the establishment who wanted to raise taxes and spend money in such a frivolous way on the Calgary Olympics. So very glad that we won that plebiscite. But also in British Columbia, the voters were able to strike down a new transit tax that governments were trying to shove down their throats.
Yeah, I mean, there's successful ones and unsuccessful. I mean, just going all the way south, for an example, though, I guess for politicians, for excuses if they fear it, Gavin Newsom dodged being thrown out of office through a citizens' initiative. And most conservatives weren't too happy to see that happen. But to be fair, as far as democracy goes, he's got a stronger mandate now than ever. He's had to face the electorate yet again. And he made his case well. So, I mean, allowing the citizens to get that chance doesn't mean a doom for the politician necessarily. It can mean a stronger mandate.
Yeah, that's right. And to that point, building on it a little bit, is that you don't need recall campaigns or you don't need an actual recall by-election to really force politicians into behaving better, right? Sometimes the stick is enough. If you know that you might have to face your voters tomorrow rather than 4 years down the road, you're probably more likely to behave a little bit better, right? So there's that incentive built within the recall and referendum type of legislation that should force politicians to actually behave better. Because look, man, if you have to go to the doors tomorrow to sell your case on why you behave badly, you're probably less likely to behave badly in the first place.
Yeah, no, you don't want to face that. I mean, there's other things you could be doing. Now, something I don't know if this could be legislated. I guess you'd have to worry about the political fallout. But I mean, Alberta had that legislation a long, long time ago. You're probably familiar with it. Social credit was in power, and it looked like a successful one was about to happen. So the government just scrapped the legislation. And how could you prevent that from happening?
Well, Cory, I mean, the only real answer to that is that can happen with any type of legislation, right? That can happen with any type of legislation, but at least then the politicians who did that would have to answer for it in the following election. Let me give you another example. I believe it was Manitoba, certainly a prairie province where you had some form of Taxpayer Protection Act. They decided to at least water it down or alter it, and they were held accountable big time in the last election. So, I mean, certainly you can make that argument about any piece of legislation. Okay, granted, but at least there's that extra check on the power, right? Right now, essentially, we just have to wait for whenever the next federal election is to be able to give politicians a pink slip. But even let's just put recall legislation to the side. We could have used citizens' initiative or referendum legislation. We could have been using that over the last little while. And let me give you some examples. I mean, we have seen the carbon tax go up 3 times during the pandemic. We saw the carbon tax go up again April 1st of this year, while inflation was already sky high. I think there's a case to be made that someone could have launched a citizens initiated referendum to stop those carbon tax hikes. At least now we would have been able to put pressure on the government about their carbon tax. Because remember, Cory, these politicians have not been honest with us at election time about carbon taxes. Remember, before the 2019 election, you had then Environment Minister Catherine McKenna tell voters that the government had no intention to keep raising the carbon tax beyond 11 cents per liter of gas. Then following the election, what happened? Well, Trudeau says now that they had a new mandate, whoa, we're going to keep raising it all the way up to, 40 cents per liter of gas. So I think that this type of legislation would give people a better tool to actually hold their politicians accountable and to actually get important policy issues on the tables all across Canada.
Yeah, another aspect that needs to be put into the legislations, I think, with these two is not just citizens-initiated referenda, but binding citizens-initiated referenda. Because if there's not a binding clause for it, then still all it is a poll. And even if it might be politically dangerous for a government to do, they could ignore the outcome of a referenda more easily in that case.
Yeah, they could for sure. I mean, they did in Calgary. Remember, that wasn't exactly legally binding. So I totally agree with what you're saying. There needs to be even more strict limits on what politicians can do or not do after a referendum. But even if that's not included, it's still better than not being in, right? But Cory, one thing I do want to circle back to is kind of where you started the conversation off. Like, why is the piece targeting Mr. Poilievre? Of course, we want all parties, all political leaders to run with recall and initiative. But the reason we focused on Mr. Poilievre in this op-ed is because his whole campaign, he's been talking about putting people back in charge, making a Canada where the government is the servant, not the master. He's right when he identifies that there's an accountability problem in Ottawa. But we think that one of the key solutions to that then is, okay, if you want to show that citizens are the boss, then input recall and referendum laws. And so far, we haven't heard him make a firm commitment to this piece of legislation.
Yeah, well, and this is the time to get those commitments. I mean, I guess you can see why they fear making those commitments. It didn't work out very well with Mr. O'Toole on the carbon tax when you guys got his signature on it. But it's important times like now when they're running to get them to make a statement on that. So I imagine you'll keep putting the question to Mr. Poilievre as long as you can.
Yeah, absolutely will. And we do want to get them on the record because, hey, when they lie to Canadians, they get held accountable, right? Unfortunately for Mr. O'Toole, Canadian voters aren't stupid. He said one thing in the leadership race. He broke his promise. He lied to Canadians, and he was held accountable, not just by Canadian voters, but his own caucus as well.
And well, in recall, I mean, it should hold some appeal for people on any end of the spectrum. I mean, if you just look at it on the surface with a good policy. I mean, I know speaking for Calgary City Council in the last two councils, there were a couple of candidates I suspect might have had recall and initiatives brought up against them, or at least attempted. And these were conservative-leaning candidates, not left-leaning ones, but they don't have the mechanism right now either. So they're stuck with these, or we're stuck with one, and are stuck with another until the end of this term.
I completely agree. And I think you're talking, what was it, Councillor Joe Maglioka when he was caught sticking his hands in the taxpayer cookie jar, Cory. I think that's who you might have been referring to.
Yes.
Yeah, but here's the thing, right? A recall and initiative, it's not really a right, it's not really a left type of issue. I mean, you can get any type of policy in a referendum, and when you look at recall usually isn't about a specific policy per se. It tends to happen. These type of recall by-elections tend to happen when you have politicians misusing public trust. Right? Or I should say abusing public trust. So for example, in British Columbia, it wasn't a specific policy per se that led to the recall campaign. It was when their MLA was caught sending fake letters to the editor, right? So the recall tool, I think, would be more for making sure politicians aren't abusing the public purse and quite frankly, just aren't trying to mislead Canadians and mislead taxpayers.
Yeah, well, and as you said, the preventative power potentially anyways, maybe some of these guys would think, okay, well, if I pull this off, I could, have to answer for it because a lot of what happens too is they pull their stunts, but they just hope that the public forgets by the time they get another chance to get to the polls. And the recall is always hopefully at the back of their mind saying, I better keep a clean nose here or we're going to be in trouble.
Hey, and one more thing I need to add, right? We've seen some success here in Canada with recall and initiative. You mentioned the fact that a lot of this happens in the States already. Already about half of the states in the U.S. have either some form of recall or some form of initiative legislation. But also, we found that there's about 19 countries, at least that we've identified, that have some form of recall legislation. Countries similar to us, or at least peers like Japan. You've got Swiss. You've got some Mexican states that also have recall. I believe there is some type of recall process in Germany as well, maybe even at the local level. But then initiative, the referendum legislation, we've identified 36 different countries that have some form of direct democratic process that allows their citizens to influence legislation. You've got Italy where there's something like that. You have New Zealand. And of course, the one that everyone knows about is Switzerland. So I just want to make clear is that there's so many different examples to choose from where you can strike the right balance federally between more accountability and making sure political chaos doesn't ensue.
Yeah, we can't pretend that it's unprecedented or there aren't working examples to go from. Well, I appreciate that, Franco, and thanks for coming on today. Where can people find more information about what you're pushing and encouraging out there in the taxpayers' world?
Well, hey, head over to taxpayer.com, check out our newsroom, sign some petitions, follow us on Facebook and Twitter. And Cory, thanks so much for having me on.
Always good to have you here, Franco. I'll talk to you later.
Sounds good.
Remember that, guys, taxpayer.com. That's Franco Terrazzano. And yeah, it's not all just the economics and numbers and pencil sharpening and all that. You know, when we're talking democracy and initiatives such as that, like recall and referenda, they're supportive of that too. And yeah, they were very strongly involved in that Calgary referendum with the Olympics. It's one of the few things I'll give Rachel Notley credit for as a premier, because Nenshi had his Olympic dream. He wanted his vanity project, no matter how many billions it was going to cost. And Notley realized that this was going to turn into a boondoggle, you know, if not just for Calgary, but for herself as a provincial government. She says, fine, we will help fund it, but first we need permission from Calgarians, run a plebiscite in that case, or a referendum. And Calgarians said no. And despite a lot of roundabout ways of tax dollars and Calgary economic development people and things all pushing, with firing from all guns to say, oh, let's embrace that Olympics bid, it went in the toilet, thankfully, thanks to Calgarians and getting the chance, and people like the CTF and Franco lobbying on that at that time. And hey, if it was a good idea, maybe, you know, 70% of Calgarians have said, yeah, let's go for it. But how would that look right now after this pandemic mess, you know, with where our budgets are, with where our taxes are? Just imagine right now we'd be sitting 4 years away from an Olympic Games coming over here. We probably would be already way out of budget, way behind on all of our scheduled construction. It would have been a disaster, and we averted it, and direct democracy did that, because no other amount of reasoning was going to stop Nenshi. He had to be stopped in his tracks. All right, let's talk about one of my sponsors again, and that is the Canadian Shooting Sports Association. You know, we're seeing that in the news a lot, right? The Trudeau government has turned around and said, you know, we're going to speed this up. We're going to rush out. We are immediately imposing the handgun freeze, essentially, at least stopping them from coming in legally across the border from legitimate companies, things like that. They are on the move. They are ideological, and they're almost hysteric with it. They want to take away your property. Even if you don't own handguns, you own a .22 rifle, or you like skeet shooting, or you like hunting. They're coming for all of that next, guys. And if you don't stand up for yourself, they will win. They will take your property. They will steal it. So you got to get together. Safety in numbers, and that's what these guys are about. It's an association of firearm owners. Canadian Shooting Sports Association. Take out a membership with them. That's how they can keep these actions up and push back for your rights. Plus, there's a lot of resources for you as a firearm owner there, as you should be with any association, something you take seriously. Check them out. They're at cssa-cila.org, and get a membership, guys. It's an investment in your rights. All right, what else? So we got on the go. This was an interesting one I saw coming through the Twitter scrolls. Jagmeet Singh is warning Trudeau their deal is dead if no dental plan is in place by year's end. Yeah, well, their deal was never all that real anyways. I mean, it's a marriage of convenience at best. Singh is too weak to fight another election. Trudeau can't run into another status quo outcome. It's ugly. I mean, Singh is scared to death of actually going to an election. I see this as a bluff, but who knows? Who knows? I mean, the thing is, he can only bend over for Trudeau so many times before the NDP gets so weak that his own membership's going to turn on him. Because, I mean, they do want to stand. They are distinct from the Liberals to a degree anyways. You know, they're just, as I say, the Liberals in a hurry, or they're just socialists. Either way, we don't have the money for a dental plan. Again, let's fix our healthcare system. That's something I talked about the other day, and I saw a meme about that. People say, oh, Canada's got the best healthcare system in the world. Oh, good. Can I go to an optometrist? No. Can I get my teeth done? No. What about my pharmaceutical? No. Mental health, psychiatrist? No. Guys, our system doesn't cover a hell of a lot, even though we spend more per capita than most of the other countries on the earth on it. But again, why add more things to cover under this system if we don't fix the system first? Then it's just making the system that much more expensive. In fact, we could end up with dental service being similar to the rest of our health service. At least dentistry is expensive right now, but you can go out and see a dentist in a very short order. There's no trying to find one who's available, who's taking patients. There's no shortage of them. There's no giant long waiting lists for dentists. And as Pamela Jones-Kenney saying, poor dental care can lead to bad health. Yeah, it is a part of your healthcare, and it's an important one. So let's look at systems where we can help manage all of our health then. And we can't just make the current system bigger because it's not working. We need to look at how we're doing it, and then perhaps we'll have the efficiencies to be able to ease those costs in other areas like dental, optometrists, or mental health, of course. As with Pamela saying, with dental care leading to other bad health. Same with mental health, of course. I mean, people end up getting injured or in hospital care or all sorts of other areas because they have mental health issues that should be treated outside of that. But we aren't treating it because our system isn't as universal as a lot of people like to think it is. And those dollars are going out. I've talked about that before. Last January, I went down to the States and we crossed into Mexico, into Algodones there, and it's Molar City. And Jane got a bunch of dental work done for basically 25% of what it would have cost up here. But that's what we have to do because we don't have coverage plans up here to try and keep it local. And Jerry Armstrong Price saying, yeah, dentists will let you pay as you go if you ask. Yeah, I mean, being private, at least with dentists, they got more options to find ways that you can pay your bills and things like that. But if we just do as Jagmeet says and just bring in yet another big bloated government-funded system, it's not going to end well for us. I mean, yeah, sure. Suddenly we will get universal dental care, which will mean we probably won't be able to get it in a timely manner, and even more of us will be going south of the border to get it done. Linda Gibson saying, I talked to some British people and they said their socialized dental was horrible. Well, I mean, yeah, you think of all places that would learn to value dental care, it would be grand old England. I mean, come on, you guys. Fix those choppers up. But they've had difficulty dealing with that. Maybe it's just because the cost of fixing all of them English teeth was too much for any system to cover. But again, there are other examples to look at. And Chris Gibson saying we do need to reduce our dental costs. And that's true. I mean, hey, it's very important to have good dental health, and it's very expensive right now. So, I mean, Jagmeet might be onto something saying we need a plan of some sort, but not under this current system. The system can't afford it. We can't even get doctors in emergency areas. We can't be expanding our healthcare system to encompass even more services that we probably wouldn't deliver efficiently either. Let's see what else we got. Yeah, here's one. So this shows how the government is just wiggling and weaving any way they can to get their stuff done. And that's they're talking about banning guns under a cheese law. This is so Canadian, this article, right? So handgun imports are going to be banned in Canada under the same law used to block dairy products at the border, Cabinet said. So we'll use every tool at our disposal because that's how stupid Canada's system is with its dairy cartels, with illegalizing other products up here. And that's why we pay through the nose for our dairy products and chicken and everything else. And we actually had cheese smugglers. How embarrassing, how weird. We really, Google it sometime if you're bored because it's just so real and odd. But the mafia got into smuggling cheese. If you make any commodity, limited and get in there and screw with the government, you will make an underground economy. And that happened with cheese. And they had to bring in legislation to stop these cheese smugglers. So then now they're going to try and use that same legislation to stop people from bringing in handguns. This government is a wreck. It just is. But it also shows, how many stupid acts we have that they can use to try further to keep infringing on a right. Here's another one. Yeah, Facebook fired a shot across the bow with the Trudeau government's plan to bail out mainstream media. Australia has been back and forth on that for a long time. And basically, the federal government wants to put the screws to the social media giants like Facebook and Google and others to force them to pay media outlets. And then, of course, the government will determine which outlets get paid and which don't. Look, guys, it's all ways the government's trying to control the messaging. We're dependent here at the Western Standard at those. We're dependent on Google for people to be able to find us. We're dependent on Facebook to get the word out, Twitter. All of those giants, we need them. It's a symbiotic relationship. When we start putting the screws to them and making them pay out to producers, then we get much bigger problems. And Facebook's saying to hell with Australia, and they've been fighting over that for a year. But you see, what the government wants to do is make sure that it's only a handful of outlets get the mainstream exposure online, because then the government can control that handful. It's the same ones, the CTVs, the Globals, the newspapers that they are tax funding and bailing out all the time, because then they can control the messaging. We're in some very, very dangerous waters right now, guys. And I'm not sure how bad it's going to get before we realize that and back out. Online forums for public services, this is what I was talking about earlier, have exploded in recent weeks with comments about the prospect of returning to the office with employees comparing notes on the hybrid work plans each department's planning to adopt. basically they don't want to go back to work. I mean, God, come on, I've been able to work in my bathrobe and do what I like in my household, I guess, all day. But if the outcomes were good, that's fine. But all of the government services are falling behind. We got immigration processes behind by years. We've got passports behind by months. These are simple renewals. Obviously, they can't do it from home, not efficiently, at least a lot of them. And yeah, one comment by a Health Canada manager urging employees to return to the office in part to provide employees at a nearby Subway restaurant with more hours blew up into a series of sarcastic memes. So that's what the case you try to make to get them. Please come back because the Subway next door is going broke since you guys are all working from home. My God, you guys are idiots. You know, in the real world, what happens? Please come back or we're firing you. That's how it works. That's how it's supposed to work. Please come back or we will give your exceedingly generous pension plan and compensation and extended vacation time and all those benefits to somebody else who will appreciate it. That's how you deal with these guys. Not by begging them, not by saying, please, get out, get out of your bathrobe and come in and actually go to work for a change because the Subway sandwich artist next door might lose his job because you guys have been in the office. It's pathetic. Let's see. Well, these challenges will carry on. I'm not sure if Gil's still doing that in Alberta, but the battle will still go on in the fact that it even makes news. But masks will not be mandatory in Ontario schools this September, the province's education minister said. We'll see. We'll see. If it spikes just a little and CTV says the world's on fire, they might rush out there because Ford loves to panic and then mask up all those children who would otherwise be allowed to smile and laugh with each other in school. It's not over, guys. The fact that it even makes news shows that it's not over. Here's an odd one. It'd be interesting to see what came out of this one. So the Montreal Pride Parade, that's a huge one. And it was supposed to start, yesterday. Was canceled, like we're talking with hours notice, like a huge event, a big affair. And they just said, no, we can't get it together. It's canceled. And I guess it was for lack of security. But I mean, it didn't occur to these guys that you got thousands. I guess, internal disorganization can happen to any group, but holy cow, this is brutal. I said they needed 100 staff to monitor the parade route and they'd never been hired. Now I wonder, and this is purely speculation and I could be wrong, but you see a problem we had in Alberta. Because if you remember, Black Lives Matter protesters managed to stop the parades and stop Pride events in Edmonton because they had a problem with the police. And it was just a lot of pushing back and forth between some very extreme activists and it just turned into a mess and it ended up shutting down Pride events. But I wonder if the fact that, they're saying they needed 100 security staff to monitor this parade route, and I don't know, but I'm wondering if the Montreal Pride ones had also told police to stay away. And if they told police to stay away, then yes, they would need private security to deal with it. Because unfortunately, there's also crazed, anti-LGBTQ extremists who might come to try and disrupt the parade and things like that as well. But something very bizarre happened over there. And a very big event has now been put off. It'll be interesting to see what comes out of that. But when they go woke, go broke, it tends to apply to a lot of things. And I suspect there's been some problems going on that led to their end. Another story in the Western Standard. Angela Pitt, she's the Airdrie East MLA, and she's leaving her role as Rajan Sani's UCP chair of the campaign for Rajan Sani with the UCP leadership. She says she needs to realign with her constituents. That's just the old almost, leaving to spend more time with the family sort of thing. She wants out for some reason or another. I suspect they're realizing that Rajan Sani's campaign really isn't going anywhere, and you just don't want to be attached to it at the end when she drops off in the first ballot with 0.5% of the votes. But whatever, we'll see what Ms. Pitt gets on with. But I mean, I'm sure she was probably capable of being a chair of that campaign and still speaking to her constituents. But we're seeing the race start to solidify, I guess, in some ways, where the people are realizing which campaigns are going to actually get somewhere and which won't. Let's see, another thing in the headlines, and it was just interesting. A buyer cut $49,000 off the price of an East York 3-bedrooms out in Ontario. But I talked to our columnist, Mike Thomas, about that with real estate and everything. He's been saying we're expecting a correction in real estate to come pretty soon. I mean, it has been super heated in Ontario and BC and some markets and everything, and it's just kind of coming back to where it belongs, perhaps. And maybe we're seeing that correction start to happen. Now that we want to see a correction And he corrected me on that when we had him on the show. Not bubble popping. He doesn't like that term, and that's fine. Because if it's fake, if it's really bad and it's a bubble, it will pop, and you can have a real catastrophe because people lose way too much equity way too fast, and it really messes the market for everything. But maybe that correction's starting to come along. But part of that correction is also because we're probably moving towards a recession. I hate using that word, but it's true. But I mean, it's almost unavoidable. The government's overspent. They shut things down. They screwed the supply chains. Interest rates are going up. What do you think is going to happen? I'd suggest to anybody, I'm not a financial advisor, we got some great ones out there, like with integrated wealth management and such who've been on here before, and I trust them for financial advice. But either way, my little bit of advice I would say, though, is looking at what's rumbling on the horizon. If you can, pay down any debt you got, particularly unsecured stuff, as fast as you can. Because the interest rates, as Neil is saying, the commenter, they're rising, and it's just hurting people, and they're going to rise more, and the economy is going to slow down. So, be careful out there, guys. Okay, and so just that reminder again, tomorrow at Rooftop in Calgary, there's going to be a debate with the UCP top front runners, those determined by, I know some people get upset, but it was determined by a very large poll, not our online one. And it found that basically far and beyond, as far as can be found, Danielle Smith, Brian Jean, and Travis Taves are the three top contenders. And it's going to go from 5:30 until about 7. It's downtown. Check it out. Go to the Western Standard online. You can see how to get tickets and how to get out to that. We'll all be there. And it will be streaming. I've seen some people asking about that. Yes, it will be streaming. So you'll be able to catch the whole thing streaming online. But it's nice to get there in person, meet with us, meet with the candidates, and check that stuff out. And tomorrow, I'm going to have David McClellan on. He founded Social Catfish. This is basically a site that helps counter a lot of those scams that have been kind of, reeling women in and robbing them and ripping them off. And I'm going to talk with Melanie Riston for a little while as well tomorrow, because she's still keeping, those episodes are coming out with her series on freedom fighters and COVID freedom fighters, and it's been going really well. And we'll discuss that a little further and see how it's been going. Plus, I'll be ranting and bitching and moaning and doing my usual things. So thanks for tuning in today, guys. I appreciate it, and I'll see you all again tomorrow at 11:30 a.m. sharp.